Well, hello and welcome to all of our gold delegates from around the world. I'm Fiona Lang Sharp, IBCLC Communications Director and MC here at Gold Learning. Well, today we're talking about our Gold Neonatal Conference, which is right around the corner, coming up, in fact, on June 1st. And I'm absolutely delighted to say that we have our keynote presenter here today, Marsha Campbell-Yeo. Welcome, Marsha. It's great to have you here today.
Oh, thanks, Fiona. I'm so pleased to be here and so excited to have the opportunity to talk to everyone through the goal learning.
Yeah, no, we're so excited to have you here. I have to say that, this topic is so interesting as well and so poignant. I think it's a conversation that happens now fairly frequently amongst all professionals who work with infants and particularly in the NICU. So I'm just going to tell everybody what this presentation is titled. So, why are we still hurting babies? Provider and parent-led interventions for the treatment and prevention of procedural pain. So yeah, I think this is a great topic, right, Marsha? I know you're very passionate about it and looking forward to sharing about it. But we've certainly seen a growth in the research as well, and how we do things differently in NICUs, which is really great, really, for all of our babies, right?
So absolutely, Fiona. I mean, I've been looking after mums and babes for, hate to say it, 34 years. And I've just really seen our shift in practice in when we didn't even think babies felt or remembered pain. And now really being at the forefront of how
Mm,
we prevent and treat pain. But is that they basically is that, we're still not doing a very good job.
mm.
And there's so much more we can do, and how important that is that we continue to really be optimal in the way that we treat and manage pain.
Yeah, absolutely. Well, we're going to talk a little bit more, I think, about the topic in just a moment. But let's roll things back a little bit because, I'm looking at this gorgeous background that you have today, which we all encouraged you to keep up because we were just loving it so much. But now we all want to know where it is and where you are in the world. So why don't you go ahead and tell folks where you are and what you do in your local area?
Sure. Well, this is my backyard, and I feel so fortunate. I'm talking today from a little place called Tantallon, which is just outside of the city of Halifax, which is in Nova Scotia, Canada. So the eastern provinces of Canada, and I work in Halifax as a full professor at the Dalhousie School of Nursing. And I have cross appointments in the departments of pediatrics and neuroscience and psychology. And really, I guess one of the main thing is that I'm a clinician scientist. So
Mm,
I continue to work clinically. I'm a neonatal nurse practitioner. Throughout my career, I started as a neonatal nurse. I worked as a pediatric intensive care nurse. I did high risk air medical transport for neonatal pediatrics
mm.
and high risk obstetrics for a long time. Then did my neonatal nurse practitioner, went on and did a PhD, and now I'm just really privileged to have the opportunity to still work clinically, but still have my research lab at the IWK Health, which
Mhm.
is affiliated with Dal University. And my research lab there is called the Mum Link. So mechanisms, outcomes, and mobilization of maternity-led interventions to improve newborn care. And we're especially interested in how we find optimal ways to treat and manage and mitigate all the adverse effects associated with pain and stress for newborns and how their families cope with it. So I'm excited, really excited to share our work and others with anyone who's going to join us with the goal learning session.
Yeah, that's fantastic. Boy, there's a lot to unpack there. So if you just that's just a snippet of what Marcia does. She's fully immersed in all areas of teaching and work, and it's just fantastic. We're really actually very privileged to have you here because we know how busy you are, Marsha. I wanted just to ask you a little bit about, again, you're fully immersed in also looking at pain management in childhood as well. So, can you tell me a little bit about some of those specialized groups that you're in and what they hope to achieve? Like, what do they look at for families and children?
So, some of the people that we work collectively and very closely with, of course, like national organizations. I am the president-elect of the International Society for the Study of Pain in Childhood, special interest group. So extremely fortunate to work with colleagues all around the world to try to ensure that the research reaches people so that
Mm,
the babies and families that we care for are receiving best practice now. We know from studies that sometimes it takes 17 years to
that's right.
get research into the hands of clinicians. And so we work really closely with organizations like that. And also I'm very, through the Council of International Neonatal Nurses, also working with people from all over the country and the world, again, to reach clinicians, to help them to improve their care. And lastly, one of the things I'm really excited about is I just recently was the inaugural chair of the scientific research committee with the Canadian Premature Baby Foundation. So
Oh.
this really allows us to work side by side and partner with the families that we're trying to help. And I'm really excited about that opportunity.
Wow, wow, and wow. That's all I can say because I think about this topic as a professional is so important to me. Now, I don't work full time in an NICU, obviously, but I do have families that are in there. Sometimes I get to be a visiting lactation consultant in there, working with the staff, and pain management is just key to so many healthy things, But also as a parent, Marsha, I was also there with a baby and so, how it was so important to me then. So I think this topic particularly impacts so many people. And I know that you're looking at the short term and the long term impacts. And I'm hoping that we'll get a chance to talk, or you'll get a chance to share a little bit about those things as well. So let's just talk. We've just got a couple of minutes left here. Tell me, what are the couple of things that you're looking forward to sharing with our audience while they're with us?
So Fiona, there's so many things that I want to share with the audience, and not just all the reasons why we should be
Sure.
really prioritizing pain in newborns, but I think even perhaps most excitingly is all of our work around knowledge mobilization and engaging families, because
Mm,
people are going to learn that really some of the most effective ways to manage infant pain is for family-led interventions. And this, it's so important for families to know this information, for care providers to know this information, and how collectively we can work together to
mm,
ensure that babies get optimal care. So breastfeeding as an IBCLC, I mean,
mhm,
it's one of the best ways we do it, and not just why we should do it, but how. So that's another thing I'm going to talk about, is really getting down to the nitty gritty, is how can each person who's attending individually and collectively really make a difference. And for people to remember that what they do every day in their work, there's no such thing as just one simple poke. It's
mhm,
only one of many, many that babies receive. And I think if people realize that for every time they reduce pain and stress related to a procedure, they're reducing the cumulative pain and stress, not
mm.
just for this baby, but the anxiety and concern of the family and how we engage families. So that's what I'm all excited to talk about.
Yay! Awesome, awesome. That's great. Well, I was just thinking as you were speaking and sharing there, that this topic applies to really anybody in, the perinatal and maternal health field, irregardless of whether you work there full time in the NICU, because this impacts long term. And I think being informed as a healthcare professional is going to be so important. So that's why we're excited to have you as a keynote. Everybody can come to your presentation. It is free and open access no matter where you are in the world. It's going to be on June 1st. You can go to our website right now at goldneonatal.com in order to register, to come and listen to Marsha. And I know that she'll be delighted to have you. She's so looking forward to sharing all of this information. And if you are working in the NICU, you know how important this topic is. And again, looking forward to sharing all of the research. Thank you so much to you, Dr. Marsha Campbell-Yeo. It's been absolutely delightful chatting with you today.
Oh, thank you, Fiona. Lovely chatting with you. And I'm really looking forward to chatting to all the participants who come and join us.
Absolutely. And once again, don't forget to go to the website right now at goldneonatal.com to register for this event. You will be able to come and listen live. We'll have Marshall be here doing a live Q&A with us as well, which is fabulous. And you'll also be able to listen to the recording if you have to work that day, of course. So, but you can go ahead and register right now. Thank you so much once again to Dr. Marsha Campbell-Yeo for being with us here today. And of course, to all of our viewers. Bye-bye for now, everyone.